Hi everyone, welcome back to this episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this video I'm going to teach you how to start working on really sensitive scar tissue. Now, sensitive scar tissue is a very common problem that I see in my clinic every week for patients who are going through or following breast cancer. So if you enjoy this content and you would like to see more, then please give this video a big thumbs up, subscribe to my channel, which is completely free, and leave a comment in the section below if you have any information you would like me to add to about sensitive scars, scar tissue, or any other topic around breast cancer you'd like more info on. Okay, so let's get into this video, how to treat sensitive scar tissue. First of all, let's just talk about which scars I'm actually referring to here, because as people who've gone through breast cancer would appreciate, there's actually a lot of scar tissue that can occur, particularly after the different surgeries that people can undergo. So as an example, we've got mastectomy scars if you've had a breast removed. You've got lumpectomy scars if you retain your breast tissue, but they just take a little bit of tissue out to get the tumor out. We've got scar tissue that occurs with a with a sentinel node biopsy or axillary lymph node dissection where they've taken out one or more lymph nodes. You've got scar tissue that can occur because of drain sites where they've removed the drain after surgery. And then of course you've got scar tissue that happens because of breast reconstruction and then also breast reduction. So that's a lot of areas that can be scarred up after breast cancer surgery. So in this video, I'm literally referring to any of those scars. If any of those scars are sensitive, then this video is for you. Let's secondly just talk about what do I actually mean by sensitivity. So a sensitive scar is a scar that it doesn't really take much stimulus to make it cranky. And by cranky, I mean painful or stinging or lightning bolt type pain or even itching or just irritated. So it might only take light pressure to make it really cranky. It might take a t-shirt lying over the top of the scar, or it might mean that if you tried to wear a bra that your scar tissue gets irritated. It might also be irritated by temperature. So if it's a cold day, you might find that the scar gets a little bit sorer than usual. Or even hot. So if you jumped in a shower and the warmer water was running over the scar, it may even get irritated by that. So a lot of people, as we know, get scar tissue after breast cancer treatment, but most of the time I would say that in my clinical experience, I see scar tissue is tight and uncomfortable, but not necessarily really, really sensitive. So this video is very much about, looking at how we treat scars that have become really easily irritable. So if you want more information on how to sort of get straight into scar tissue massage if your scars are tight and painful but not necessarily sensitive, I'll just put a little card up here that's going to link you to a video about how to reduce scar pain after breast cancer. The other main message I want to push in this video, of course, guys, is the fact that scar pain, scar sensitivity, and scar tightness should not be considered a new normal after breast cancer. If there are any health professionals or medical professionals that work with breast cancer patients that are watching this video, please, please, please listen to your patients if they're reporting scar pain, scar sensitivity, or scar tension, because this is one of the main things I treat in my clinic every single week. And with all the other issues that I treat for patients going through breast cancer, I must say that this is one of the most straightforward issues you can actually get better in a pretty short space of time. So patients out there, if you are experiencing scar pain or particularly scar sensitivity, then keep listening, because what I'm about to do now is walk you through how you actually start to desensitize a sensitive scar. So the two mainstays of treatment that I use to reduce scar sensitivity are massage and a product called Mobiderm. Now, I'm not actually going to show you Mobiderm in this video. I've actually talked about Mobiderm in a number of my other videos, and I'll just put a little tag here up to another video that's got Mobiderm in it. The video that I referred to before about how to reduce scar pain after breast cancer treatment has also got Mobiderm featured in it as a product that you can use. But in today's video, I really want to focus in on how you use massage to reduce scar sensitivity. Firstly, let's talk about how to tolerate the massage. So if you've got a really sensitive scar and we're saying, well, let's just start with some massage, you'll probably be thinking, but I can't even bear to touch the scar. It's that uncomfortable, that yucky for me to even think about that scar, look at that scar, touch that scar, that I don't even know where to start. So my first message here, guys, is just work to the limits you can tolerate. So if you can only stand 5, 10, 20 seconds worth of light pressure on your scar, that is totally fine. Just appreciate that as the body gets used to that mechanical stimulus, which is pressure on the scar, and as time goes by and as you keep working through this, it will get better. It might take a little bit of time, but it will get better. And the other reason I mentioned Mobiderm, of course, is that you don't always just have to use massage as a treatment technique. If your scar is super sensitive, by all means, you can utilize products like Mobiderm as well as massage to improve your scar. So first and foremost, like I said, work to your tolerance limits and keep the pressure light. So light pressure is, again, what you can tolerate. The other thing I should mention is that sometimes rather than actually doing like a moving massage, a lot of people can tolerate a pressure point rather than moving massage. So if your scar is super sensitive, you may just literally want, say if I've got a scar here on my arm, you may literally just want to apply light pressure, but keep that pressure still. So rather than doing massage where you're moving, which can irritate a sensitive scar, you may find that just applying really light pressure so that the scar gets used to that mechanical stimulus slowly over time is a good way to start. As far as how frequently we should treat sensitive scar tissue, I always suggest to patients who've got really sensitive tissue to just do short, sweet bursts, of massage or pressure points. So you might do 10 to 20 seconds or slightly longer. It doesn't really matter. It's up to you. It's what you can tolerate of massage, but you might do it 3 or 4 times during the day. When I have patients who don't have sensitive scar tissue and they can, happily get stuck in with firm massage, generally speaking, I'm saying to them, maximum do this massage once a day if it's firm, because if you're doing it multiple times a day with firm pressure, you're going to make that scar actually sorer than it needs to be. However, when you're treating a sensitive scar and you're only doing light massage and you're doing it for a really short amount of time, you can get away with doing it more frequently because you're not going to be pummeling that area of scar tissue. So hopefully you're going to be more productive by doing short, sweet bursts of light pressure, just getting that area of your scar used to mechanical pressure over a longer period of time. I would always recommend that we use cream when you're doing scar tissue massage because, like I said before, if you are trying to get scar tissue to desensitize, the last thing you want to do is create a drag on the skin. Now, most of the creams that I recommend to patients, particularly when they're following or going through radiation, will be a water-based low pH moisturizer. I do get a lot of questions through my YouTube channel about which moisturizers to use, but generally speaking, if you've got a moisturizer at home that doesn't irritate your skin and you've used it before and you're happy with it, then I'm more than happy to say keep going with that moisturizer. But if you want particular brands, the brands that I tend to recommend are Sorbolene, QV and Mugu. Some of those are Australian-based products, but essentially if you're in another country watching this video, then just keep a water-based pH moisturizer as your go-to for what cream you use for massaging scar tissue. The last point I want to make in this video, guys, which is quite an important one, is the idea that if you've got really sensitive scar tissue and you need to get that treated, sometimes what can happen is people go along to their physiotherapist or occupational therapist or a massage therapist and they want to get their scar treated, but if they're meeting that therapist for the first time or they haven't really had a chance to build up a bit of rapport and trust with that therapist, it can actually be really intimidating to have somebody else come along and treat a scar that is super sensitive, as opposed to you doing it to yourself. So sometimes for patients who've got really sensitive scar tissue, where I start to massage their scar, and even in the first 5 seconds of massage with mild pressure, they're like jumping off the bed because it's so tender and sensitive for them. Sometimes I actually stop massaging and I suggest that they start to practice this technique on themselves, because the patient feels way more empowered when they've got control over how much pressure goes on, how they use their hands, what cream they use, what time of day they do it, how frequently they're doing it. All of those factors come into play to make the patient feel more in control over how they treat their scar. Unfortunately, when you have a sensitive scar, the only way generally forward to get it better is to start treating it. If you ignore the scar tissue and hope that it's just going to disappear and get better by itself, generally doesn't happen. And when health professionals are sometimes saying to my patients, oh, that'll take 6 to 12 months or 6 weeks and that'll just turn around and get better, I just don't find that happens. So the other good take-home message as well here, guys, is that I've treated patients for scar tissue problems who have had their breast cancer 10, 15 plus years ago. So I really do find that it's not never too late to treat scar tissue, but I have had really good experiences treating patients who've got still irritable, sensitive, cranky scars years and years down the track after their treatment. So it's not never too late, but there's a lot you can do for older scar tissue. Thank you so much for watching this video, guys. I hope you've gained some great information on how to treat sensitive scar tissue. If you have any questions about this topic, then please leave a comment in the section below. Subscribe to my channel, which is completely free. I'll see you back here next Tuesday for another topic, and I hope you're having a great week wherever you are. I'll see you next time. I'm Jen McKenzie, the Breast Cancer Physio.